this one. Good to go? Well, good morning, Queensland. The good news about COVID cases is we have 0 new cases overnight again in Queensland. We are now down to 13 active cases, and we've had 7,247 tests in the last 24 hours. So I thank people across Queensland who continue to come out and get tested. It's not surprising that we have seen that testing number go up, because we assume there'll be people who have travelled to New South Wales or South Australia and are making sure that they are getting tested if they have any symptoms. And of course, we remind people there are still venues and restrictions in place in relation to various states, and they should be checking our sites, and particularly those venues and any updates of those venues from Melbourne. Also, we have seen today reports around Queensland's vaccination rollout. And can I say that Queensland is on track to be delivering their vaccination rollout as planned. Queensland has about 20% of the Australian population. We have vaccinated 20%, just as New South Wales has 40%. Proportionally, they've done 40% of their vaccinations. So we are all on track in delivering our vaccinations. Of course, different states have chosen to now use different models for delivery. Collectively, though, the numbers are still the same. In Queensland, we have chosen to continue the agreed model with the Commonwealth of vaccinating those people who are frontline workers in the 1B cohort, which now means those people, we are the only ones delivering the Pfizer vaccine, and the majority of those people are under the age of 50. So we have a much smaller need for AstraZeneca now. And our GPs and our Commonwealth Respiratory Clinics are doing the broader population that are eligible, so the 50 plus and other vulnerable cohorts. Early on, we were still getting our AstraZeneca deliveries. However, we did not need them with the drop-off and the changes with the TGA, because the bulk of our workforce was needing the Pfizer vaccine. Initially, the Commonwealth was requiring us to return that back to the Commonwealth first, so that it could then go back to GPs. We've now got agreement with the Commonwealth that Queensland's supply, so the state government supply of AstraZeneca, can now be redistributed directly to GPs. So I want to make it clear to Queenslanders that our supply is not going to other states for their mass vaccination centres. The Queensland supply of AstraZeneca, instead of coming to the state government for our hubs, is now going directly to GPs, which is what GPs have been crying out for. They want more supply. Now, we want to see, as we were doing only a couple of months ago, over 7,000 vaccinations a day, we want to see those numbers again getting up there. But of course, we needed to set up our Pfizer hubs across the state. From the end of next week, we'll have all of our hospital and health services regions set up for the Pfizer vaccination. We believe this is the best model. We need to make sure we're taking the Pfizer vaccine to those frontline workers in such a decentralised state. We also believe, and we have called on both Dr. Young and I, for the Commonwealth Health Minister to support the rollout to GPs to be expanded to all GPs on the National Immunisation Program. They're already trained and skilled in immunisation. These are the people, the professionals, who deliver the flu vaccine every year, who are in all of our communities. And if we expand it to all of these GPs, we can get the large portion of our population done far quicker. So we've put that proposal to Greg Hunt. We know it's a supply issue at the moment with AstraZeneca, as in you can't give it to all of those GPs at this stage because it would mean much smaller supplies to each. But when that supply is adequate, we do call on that to happen. Now, if I can specifically address the numbers, so I can confirm that we did collectively across Queensland 14,443 vaccinations, the third highest vaccination rate across the country last week. with New South Wales being the large population first, Victoria second, and then Queensland with our total number of vaccination numbers. As far as Queensland's actual deliveries and our orders, our Pfizer vaccine numbers have increased week on week and will more than double. We were getting 14,040 vaccinations on the 12th of April of Pfizer, and come 10th of May we'll be getting 35,166. The difference is we will not be getting future AstraZeneca for the next couple of weeks because we are not needing AstraZeneca based on our cohort that we're delivering. We did have a reduction on the 26th of April that's being reported. We had a reduction down to 15,378. And can I clearly explain why? When vaccines are spoilt through a breach of a cold chain supply, they are not delivered to us. We had in that week 6,700 Pfizer vaccines where there was a significant cold chain breach in the distribution, which was not delivered to us and could not be used. That was in Cairns and Townsville. But I'm pleased to say that our future deliveries have gone back up to 26,000 and, as I say, 35,000. So it is important that we make it clear to the people of Queensland that we are delivering at the same rate as every other state, that we are on track to deliver our vaccines, but we also believe the best people to be delivering this vaccine to the broader public are our GPs. And we say this because the evidence we have so far of people who haven't been vaccinated in Queensland is that many of them will take whatever vaccine is on offered if their GP recommends it. Their GPs are the ones who give them confidence. Their GPs are the ones who are going to help them have that informed consent. So we agree that people have confidence in their GPs and their GPs are best to deliver to the broader population. We support that call of GPs, and that's why we've asked Greg Hunt to also broaden the scope of the GP rollout. I'll ask Dr. Young just to talk briefly about COVID and what's happening with the other states still with restrictions, and I'll then open up to questions on the vaccination rollout. Of course, I've got Dr. John Wakefield, Director General of Queensland Health, here as well to answer any questions in relation to the rollout as well. But I reiterate that by the end of next week we'll have our hubs for Pfizer set up across all 16 hospital and health services. Thank you, Dr. Young.
Thank you very much, Minister. So no new cases in Queensland overnight, which brings us down to 13 active cases, but it's really, really good to see the large amount of testing that's happening across the state. Although we have no cases in Queensland, we of course know that other states have had issues in some of their quarantine hotels, and that has then impacted on Queenslanders returning home into Queensland. So please, virtually anyone who has been outside Queensland in the last 14 days, no matter whether it's been New Zealand, Perth, Melbourne or Sydney, please just go onto our website and check that you haven't been to one of the venues listed by one of those states or indeed by New Zealand. And it's really important, if you have, that you come forward, as so many people already have, and get yourself tested and ring 13 Health for advice. So if you've been to any one of those many venues, and there are a lot of them, if you've been to any of those, please just isolate yourself, get tested and ring 13 Health. That's really important. So some of those states are coming to the end of those outbreaks. They've all managed them brilliantly and not seen spread through their community, but there's still a risk. So we all just want to mitigate that risk. Thank you very much.
Questions?
Would you mind just going back through? I was just a little bit
Sure.
confused about the numbers dropping off for that week, even though
Yeah.
we had the spoilage.
Yeah, so there's two reasons why the total number of vaccines have reduced coming into the state government versus the whole state. And we have to be clear There's the total number of vaccines being done across Queensland, and then there's what the state government is delivering as part of our 1B obligations. Our number of total vaccines have reduced because we are now, we have entered into an agreement with the Commonwealth that the state government's projected numbers for AstraZeneca, we have asked they go directly to GPs. That's what GPs want. They want more supply. We hear it each and every day, people ringing up, wanting to get in and saying that the GPs can't take them. So we want more supply to GPs, and so we have surrendered basically our AstraZeneca numbers so that they can go straight to the GPs in Queensland. So Queensland's still getting the exact same, their fair share of vaccines, but it's going to GPs instead of coming into our hubs. But what we're seeing is a significant increase in the Pfizer vaccine coming into us. So we've gone from 14,040 Pfizer being provided to the state government on the 12th of April, going up to 35,166 on the 10th of May. So our Pfizer vaccines are going up, but our AstraZeneca vaccine is going down for us because we're giving it to GPs. But there was 1 week where we saw a significant drop, which was down to the 15,378, which we've seen reported in the media today, and that's because over 6,700 of those vaccines were spoiled and never actually delivered to us.
On those stats, the statistics, 2 questions. The stats in the paper today, are they accurate? Secondly, you mentioned that we had the 3rd highest vaccine rate in the state last week. Can you just clarify exactly who
So
that, and also
today,
what dates that
sure.
refers to?
So today there is a report that on the week ending the 25th of April, we had received 41,160 vaccines. And that the following week it dropped down to 24,570. That is correct. For 2 reasons. Our AstraZeneca went from 19,200 down to 900 because we've now given that to GPs. The other one is we lost 6,700 Pfizer vaccines that never came to us that were supposed to. So that's why we saw a significant reduction. You will see a total reduction in our vaccines going forward because we are not getting AstraZeneca supplied to us over the next 2 weeks. But our Pfizer is going up. So AstraZeneca is going to GPs. In relation to the total number, as I say, 14,443, and this is the Commonwealth's data. So the Commonwealth collates all of the data of what the state's doing, what the Commonwealth respiratory clinics are delivering, and also what the the primary care, so our GPs are delivering. So across Queensland, collectively, we've all delivered 14,443 vaccines, and that puts us the 3rd highest vaccination rate in the country.
What date was that?
So that data is as at 12th of May.
What are we doing to make sure Queensland gets its fair share of Moderna vaccines? Can they get approved?
Well, we are waiting to see the detail of when that's going to come, but I might ask Dr. Young if there's been any discussions at a national level on that, because as the Queensland Health Minister, there's been no communication directly with me on the Moderna and the announcements made this week about the vaccination.
Is that disappointing?
Oh, look, it is. I mean, it's difficult because we're all doing our best. We all want the vaccination rollout to be successful, and we want it to be rolled out as quickly as possible. And so I'm not criticising the Commonwealth in what they've announced. I just need to know the detail. So they announced money to go towards vaccines and the vaccination rollout, but I don't know if the money that was announced, and I said this in Parliament this week, the money that's announced for extra vaccines, I don't know if that's the vaccines we've already announced. So when the Commonwealth announced 20 million extra Pfizer 4 weeks ago, I don't know if the money announced in this week's budget is simply to pay for that, or if we've got more vaccines coming. If we've got more vaccines coming, great. Tell us what it is, tell us when it's coming, so we can plan for it. Because as we've seen with the change with the TGA advice, it's taken us about 4 weeks to train up, remembering every hospital outside of our 6 hubs in Queensland was delivering AstraZeneca, and only AstraZeneca. And we've had to now turn that around, train them up, have them accredited, and get the freezers into every one of those hubs so that we can store the Pfizer and then set up outsourcing or outgoing groups who can now go out into the regions, and through a whole different working with the Aboriginal and Torres Strait Islander Community Health Services, working with the Royal Flying Doctor Services, working with primary health networks of getting those vaccines now out into the broader community. And I believe Thursday Island will start getting their visor in the next week, which is fantastic, but it's taken us time to have to, recalculate it all and make sure they're all trained up to make sure that this is being delivered in a safe way. But I'll just pass on to Dr. Young to see if we've got any more information on Moderna. Thank you.
Thank you. Well, this is really exciting. So we're going to get 25 million doses of Moderna into Australia. So the first 10 million will start arriving at the end of September, and we'll get it through to the end of the year. So there'll be those 10 million doses. And then next year, the plan is to have 15 million doses, but it'll cover the newer variants. So that is really exciting. Plus, there's a suggestion that Australia might be able to make its own Moderna vaccine. So all of that work's happening. And this is a really, really rapidly evolving area and is fantastic to see. So Australia is going to have so many options going forward. It's really important at this point in time that we continue the rollout with our current vaccines, but we can see what's happening on the horizon.
How do we ensure Queensland gets its fair dibs?
We've been getting our fair share every step along the way. We've been getting our population share of 20% of the vaccines. I've had no concern about that. It's just till now there hasn't been enough to get the amount we would all like to get. But that's true for every single state and territory, and the Commonwealth is sending it out as quickly as they can.
The health minister said the rollout's on track. Given there's no targets anymore, what's the measure of the rollout being on track? What do you use to...
The measure is using the vaccine that we're being given. And as soon as we saw that there was an issue with us getting too much AstraZeneca, because it just wasn't appropriate anymore, because that's not the group we were vaccinating, we immediately worked collaboratively to sort out the best way of using that vaccine, which is why it's now going to GPs. So we've got a really good system. We've got to remember we're really good at vaccinating. Our GPs in Queensland vaccinate over 95% of kids who are meant to be vaccinated at particular stages. They do it really, really well. They vaccinate enormous numbers of people against flu each year. So they're the right people to provide the AstraZeneca vaccine, and they'll do it exceptionally well.
Do you have any figures, whether it be anecdotally or official figures, around vaccine hesitancy, particularly involving AstraZeneca?
Well, we've just seen a drop-off, but that's because people followed the advice. So ATAGI came out and said very suddenly, based on the evidence from overseas, that people under the age of 50 should preferentially have Pfizer. And that's what happened overnight. People heard the message, so things changed overnight very effectively. And that's what we do. We can quickly change as we get new information. And that's what happens throughout our programs.
Minister, there were some comments made in the House this week about cases the LNP were putting forward in the public health system. We heard from some of them yesterday. Is there anything you'd like to say to them?
Oh, look, every case stands alone in relation to the circumstances surrounding it. So there are thousands and thousands of Queenslanders that come into our public health system every year to get surgery, whether it's elective surgery or trauma. And our health workers do an amazing job. There's a whole range of reasons why sometimes there's delays in those surgeries around individual cases and circumstances around it. There were two ladies who came in yesterday who spoke to the media. I had the opportunity to speak to one of those women privately with the Director General, and I thank her for that conversation. All she wanted to do is make sure we were aware of the issue and see if there was ways that we could improve the way that we are delivering that care. And she certainly raised some good points that we've taken away and we're discussing with the relevant hospitals. So, we want to hear these issues, we want to hear these stories, but we also need to make sure that we're putting the context around them. I'm not going to have a running commentary each and every day talking about people's personal cases and circumstances. It is not appropriate. I will respect everyone's privacy and not be airing details about their health records and their circumstances. But we also all need to stop and reflect on one thing. And this is something the LNP, for some reason, continue to deny and ignore. Every hospital in Australia has delayed surgery right now, has pressures on their emergency departments and consequently delays with their ambulances. We have delays in our elective surgery, despite we've done an incredible job in trying to catch up on a lot of that, and we're continuing to do that. But every time there is a breakout in any state, there are suspensions, there are restrictions put in place in hospitals that lead to further delay. We all have a delay in our elective surgeries because there was a national cabinet decision last year because of COVID. We are just one of many countries around the world who has disruption to their health services. The World Health Organization has just again done a second survey of 132 countries, which includes Australia, that shows over 90% of these countries still have disruption to their health services. So I understand people may be frustrated or concerned about delays, but we ask you, please understand our health workers are doing everything we possibly can. Ultimately, we've made the decisions that we have because we want to keep Queenslanders safe. We want to make sure that our hospitals are not overwhelmed by people in ICU dying from COVID. That has meant that there are delays in other parts of our health system. We will do everything we can to catch up with that demand, to meet that demand and to meet everyone's expectations. But what we are experiencing globally, nationally and here in Queensland is something that we all need to live with at the moment and understand that we do have these pressures, but we will continue to do everything possible to deliver the best quality of care to Queenslanders.
Minister, a 12-year-old girl on the Sunshine Coast needed urgent knee surgery. She had to wait 8 months to get surgery. What's being done in terms of wait times on the Sunshine Coast?
I just said I'm not going to talk about people's private cases.
But is 8 months too long to wait?
I don't know the circumstances around that individual. I'm not the physician. And it's not appropriate for me to start looking at their personal circumstances to look at, of course I'll follow up if there appears to be delays in any health care. But without knowing the context around that particular incident and why that individual has waited the length of time they have, it wouldn't be appropriate at all for me to comment because I just don't know the circumstances.
Well, the context was that apparently it kept getting pushed back.
Again, without the circumstances, knowing the individual and what has occurred in that particular case, it just isn't appropriate to comment. And no health minister is going to give a running commentary on individual cases in the health system. It's not appropriate. I have to respect, and I'm obliged by law to keep the privacy of individuals.
On the vaccines, just going back to that again, you mentioned we are ordering less AstraZeneca vaccines because we don't need to vaccinate people under 50 with that. But we've spoken to GPs who say they would like to get some more AstraZeneca vaccine out there. Why are we ordering less? Because
No. I'll clearly state this again. We are not ordering less. It's just our supply is going to GPs. We are not ordering less AstraZeneca in Queensland. There is no less AstraZeneca coming into Queensland for Queenslanders. It is coming in. It's now going directly to GPs instead of coming to the state government. That's what we want. We've listened to what the GPs want. We want to make sure they're getting the supply they need. So there is no reduction in supply of AstraZeneca in Queensland. There is just us now diverting our supply to GPs.
So those stats in the paper this morning, is that a bit misleading, do you think? Or just explain that? Because you read that article...
Because they're just talking about the state supply. They're just talking about the state-administered vaccine. You have to look at all of the vaccines that are being delivered across each state to give an accurate reflection of where we are with the rollout. So it was only talking about what the Queensland government has received. It's not talking about what the whole state is receiving.
Thanks everyone.
One last question. In terms of looking at states, because you made the comparison about states' vaccine rates before, the best comparison I guess we can make is with Western Australia, another big decentralised state. Why is Western Australia vaccinating its citizens at a faster rate than Queensland?
It's not.
I'm just looking at the stats. Even in the last 24 hours,
I'm happy to give you the stats, and these are not Queensland stats, they're the Commonwealth stats. So, I will go through the figures. Nationally, they have provided 82,284 vaccines as at the 12th of May. ACT has delivered 1,432. New South Wales has delivered 26,151. Northern Territory, 991. Queensland, 14,443. South Australia, 6,483. Tasmania, 1,891. Victoria, 23,393. Western Australia, daily total, 7,500 across the state. So let's be clear in our reporting. What counts is how many doses of the vaccine is being administered across an entire state or territory. If we're going to make comparisons, you have to look at all the vaccines. Western Australia, as at midnight on the 12th of May, had delivered 7,500 daily total, and Queensland had delivered 14,443. So I'm happy to ensure that there is accuracy of data getting out there. You cannot just look at what the state governments are doing. You have to look at the total vaccine administered for that state.
Thank you.
Everyone.
Thank you.